Don't ever change.
Hey, welcome back to another episode of Mind Your Body and Soul, the Healthy Podcast, the healthiest podcast you have ever heard in your life, brought to you by Neighborhood Medical Center. I am Joseph Ward, and I am joined by the dynamic, the vivacious, the exclamatations. I just made up a word for it. Mr. Alana Steaple. How you doing today?
All right. Hey, it's a great day. Great day.
Yes, ma'am. Yes, ma'am. Remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves, rather. And remember, every Wednesday, sometimes Thursday, life be happening sometimes, but mostly Wednesdays, you're gonna catch this podcast right here on our YouTube channel. Subscribe, comment, like, share, subscribe, comment, like, share, subscribe, comment, like, share, subscribe, comment, like, share. Now it's stuck in your head. See, now it's stuck in your head. Now you got to do it. Remember our website, www.nmcpodcast.com. We're available on iTunes, Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, all of those things, all of them.
All of them.
How you doing, Miss Steve? I like them earrings, though. I like your piece.
Hey, do you like them? You know what? I woke up this morning, and because of so much that has been going on in the world, I'm like, we need peace. Right. We need peace. And so, I remember wearing bell bottoms that had the peace signs on them, and now it seems like we're kind of going back to the 60s and 70s, and I love it. So it's all about peace, right, Joe?
Peace and a ball of hair grease. There you go. All right, so we want to dedicate this episode today as a more of an introduction to open up a broader discussion, and we're gonna have more discussions about look on us. It's Mathias.
What's going on, guys? Sorry I'm late.
Right.
Good. That's all good, B. That's what's up. So, hey, y'all know who he is. Straight out of Panama City, really going down. Mr. Mathias Sweet jumping
in. What's going on, y'all?
Out here. Hey, he put saving lives on hold to come talk to y'all. That's how dedicated he is. He's twice dedicated. He's saving a life with one hand and podcasting with the other. Get your mind.
That's right.
That's right.
That's
correct.
So men's health. It's a big topic. Mm-hmm. It's a topic that a lot of people like to hit on. It's a topic some people don't care about. But being that this is a health podcast, and 2 of the 3 of us are men. Last time we checked, we men. So we want to make sure that we are a part of the conversation.
That's right.
To open up more discussions, and not just more discussions, but more spaces that can lead to more resources and more action towards an improvement on the way us men take care of our health. Right?
And Joe, the thing is that I want women to also pay attention to the next few podcasts in reference to men's health, because women, we're the ones who purchase the health care in most of the families, and we're the ones who look at things that happen to our husbands, and we're like, I know something's not right.
Right.
But what is it? So I want women to don't tune out the next few podcasts in reference to men's health. Yeah. Tune in, because we can save our partners, our husbands, our loved ones, health, brother, uncle, cousin. So tune in, ladies.
Yeah. So, okay. And what's great is we were having a discussion earlier about men's health. And I know, the government tapped my phone, so it was messing up. I don't know. We were trying to talk.
No, you
Like,
try to blame everybody else. Your phone said blah, 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 blah.
I'm the enemy of the state, I guess. I don't know.
You're the enemy of the state.
So now one of the things we were talking about was just the general care of going to the doctor. That's the general thing. And so, Ms. Steeple, you were saying about the societal
Impact.
So could you kind of go more into depth on that for our listeners?
Well, the thing is that, you know, when we as women, we think, okay, before we get our monthly cycles, our mom takes us to the doctor, they give us that little talk, and then all of a sudden we have our cycles. And then the next thing you know, we're having babies. So we're automatically put into the healthcare system very early on. We are taught to, if something isn't right with our bodies, to pay attention.
Yeah.
However, men, if you really stop to think about it, not all, but several, really look at men don't cry. Oh, does it hurt? Suck it up. You know, go on out there. Oh, the bone is broken. Just wrap it up with some tape or something. And so men are almost socialized to not seek care because it's not the quote unquote manly thing to do. I don't know. I never could figure that out, but that's pretty much how society will look at it.
Yeah, but you know, most, you know what I'm saying? I guess just thinking from a man's perspective, you know what I'm saying? Man's the provider, you know, that's what they set out to be. They're always got to work to take care of. And I guess it's in their nature as to, I got to take care of the family. I don't really have time for myself.
Right.
But if my penis is burning or I got these strange bumps or I'm not feeling well, then I'll go to the doctor. Or after I've been there for a couple of months, you know what I'm saying, maybe a week or two of these symptoms, okay, it's time for me to figure it out. We're not like some of the women, I guess, that's, you know, women say, oh, I feel funny, I'm going to the doctor. They're not going to wait till it clear up or see what's going to happen the next few days. I mean, but you got some men that are the same way.
Yeah, very much so.
From working in, you know what I'm saying, like with sexual health and stuff, you know, we see it. Oh, I went and I had sex with this person, now I need to get an STD test. But it doesn't work that fast. Like, yes, it's great that you want to come in and get tested, but you had sex last night. It hasn't even had time to manifest, to make anything, or for anything to show up just as yet. So if I test you today, doesn't mean that you're going to be negative. Right. And I think a lot of men's minds is once they go to the doctor and get the lab results, okay, I'm good. Yeah. But things could change at a drop of the dime from when you got that blood work.
Right. Exactly.
Yeah. Yeah. And follow up with that. Okay, so we're talking about the societal thing on it. So I agree with what Mathias is saying as far as the way men are socialized. So we're now coming to a time where equality is being pushed, or it's being verbalized, I would say, by a lot of people. I don't know about fully pushed, but it's being verbalized. Okay. So, and then you have more women who can take care of themselves nowadays versus 30s, 40s, 50s. It's like the woman stays home, the man has to go work 12 hours and come back home. So if I'm working 12 back-breaking hours 7 days a week, I have no time to go to the doctor. And we can see that in some of our clients, our patients. Sure. They literally have no time to go to the doctor because they're trying to make a living for themselves. So that plays a part in that when we're talking about the socialization of men in health. But it's crazy though, because think about it, men in athletics pay attention to their health. They do. Because you have to, because that's your meal ticket.
Right. They're elite athletes.
That goes back to with some women. And from me and Joe working in the community, working with prostitutes. Right. Or commercial sex workers. I don't want to call them prostitutes. I want to use a political name. Commercial sex workers. But they actually go to the doctor and they're actually healthy. They're taking care of themselves because they know if I get sick or torn down and I can't use my body parts no more, then I can't make money. And I think that's what it goes to when people in certain like certain fields or certain health cares or certain like sports. If I know my body breaks down, I have to take care of my body because that's how I eat. And
Right.
so a lot of people who are out there, one, they don't really have to worry about, you know what I'm saying? They think they feel fine, but they don't know.
That's
But
right.
when you go to the doctors, when you find out stuff. But
Well,
you understand though, Miss Steeple,
uh-huh.
they feel fine, so they don't want to go. And like Joe said, they working 7 days a week. What clinics do you know that's really open on Saturday and Sunday? So they might be working the 5 days a week, but can't get in. Or then if they take off, they can't get into the appointment to so long, but then they got to request
That's
off
true.
from work, but they don't have the time because
That's true.
saving the time for if I really get sick, or what if my wife or girlfriend's sick and nobody's to watch the kids, or if the kids get sick and called out of school, we got to pinpoint off of who's going to stay home today versus who's going to make money.
And I guarantee you it's the female that's going to stay home. But if you really stop to think about it, even advertising puts a female's health front and center, because
Right.
during the day you see the Tampax commercials, you see the feminine hygiene commercials, you see summer's eve commercials,
It's a bigger.
and guess what? Stay up at 1 o'clock at night. I think I know the 1-800 number to every ED.
See, I often say it depends on what channel you're watching. Now you might get that prayer cloth commercial now.
Oh yeah, that's true.
Well, you know what though? Like Miss Steeple, we were talking about this morning with one of the clients this morning, and we were pushing him to actually do his own for himself. But the actual wife is taking care of everything, making sure he takes his medicine, making sure he does this. And that frustrates me because you need to be able to take care of your own health. Because what happens if something happens to that partner or that
Oh
person
my
that's pushing
gosh.
you to take yourself?
Okay.
And then now we broken up, and now I'm sitting here and I couldn't tell you what I take, how I take it, when I take it. And that's what a lot of men do. They rely on the women, which isn't a bad thing.
No,
But you got to be able to, they can't even make their own doctor's appointments. They have, the wife has to call and make the doctor's appointment. And that's the thing that me and Joe preach. Like, you got to be able to take care of yourself.
Look here, fellas. This is to my small rant. Yes, rant. I want you to look me in my eyes.
You on your soapbox?
Your health is your responsibility at the beginning, middle, and the end of the day.
say it again.
It's your responsibility. It's just me, and I'm not saying I'm right, but I do get frustrated by the amount of patients that we have who are grown men, and either your mother, your grandmother, your girlfriend, your wife is the main person who's handling your affairs, and there's nothing inhibiting like you from doing what you need to do. You just have always allowed somebody to do it for you, so that you should not be 25 years old and your mother is calling, setting an appointment for you. You tripping. Your health is your response. You have to care that much about yourself. If you're a grown man, if you can get yourself to the corner store, you can get yourself to the club, you can get yourself to the store to buy shoes and all. You can get yourself to all these places that you want to go to. You can get yourself to the doctor. Like, fellas, let's do better. Let's start to make sure we are taking full responsibility of our health. Like you said, there's nothing wrong with having health, but somebody else shouldn't be doing all that for you. We have to take better accountability of ourselves and our health. Like, we just have to. Just got to.
We have to. I have to admit though, Joe and Mathias, man, I've been popped on the hand many a day because I want to do it for them. Oh, Miss Steeple, let him do it himself. Oh my goodness gracious.
And I enjoy, I don't mind helping the patients get it done because at the end of the day, we know it's done. But a lot of times, and it hurts me to say I need you to do it because I know I can do it.
Right.
But I need you to learn to do it because if I'm not here, if something, God forbids, and something happens to Joe, Mathias, and Miss Steeple, who's gonna do it for you? You be like, well, Miss Steeple used to just do that for me and just call in this and do that and do this. Well, Miss Steeple's no longer here. It's a new person in charge.
Right.
you don't know where to go from there because they're not going to do or know what we know. And not saying that it's a bad thing, but we got to put some of the responsibility back on you because a lot of times people don't understand when we call doctors' offices, they don't want to talk to the provider. They want to talk to you because if you're that person that keeps missing appointments and I keep setting them, the doctor's office feels like, oh, you're not telling the patient when the appointment is, so they're missing an appointment, they're missing this. You could be charged at a lot of stuff and all these different things. So they really don't want to talk to us. They want to talk to you guys.
Yeah. And I do want to clarify this. Your health is your responsibility. I'm standing on that, not moving. But that doesn't mean you're not going to have a support team around you.
Mm-hmm.
Right. That's exactly right.
Go back and check out our podcast about making the most of your healthcare visit. We spell out the team around. We literally illustrate the team that's going to be around you.
That's right.
But
That's
it's
right.
your team. You're the captain of the team.
That's right.
So if you don't move, the team don't move.
And
And so-
also, oh, go ahead, Ms. Steeple.
Well, I was about to say, that's why the next few podcasts, when it comes down to men's health, is so important. So important for y'all to tune in, men and women. So, you have to, like Joe said, it's about, we're here as the scaffolding. You're the main building. We're just here to support. And so that's why it's just very important. So, Mathias, Mathias and Joe, what are some of the topics in the coming weeks that y'all will be looking at for men's health?
Well, because men's health and women's health, they go hand in hand. Yes, women are a little bit more complex than men, but things go hand in hand. So even I don't want the ladies or the women to feel like they can't listen in and get information because some of the stuff goes hand in hand and we'll be there. Right. But we're going to cover, men have issues with diabetes. We have issues with weight. We have issues with nutrition. We have issues with hypertension, high cholesterol, different things like that. We're even going to try to do some things on some stress, to figure out what happens because a lot of men are under a lot of stress. And because, they're the sole provider, everything. But That's one right. thing that I can't stress enough, and Ms. Steeple and Joe, tell me if I'm right about this, but we want men and women, even though we're talking about the men, but women as well, we need y'all to be truthful with us. You need to tell us what's going on. You can't just sit there and say, hey, I keep coming up with this STD.
Yes.
How are you getting this STD? Are you sleeping with the same people? Is it different people? Is your partner getting tested? Or I keep my blood pressure medicine not working. But did you change your diet? Did you change from a high sodium diet to a low sodium diet? Did you change your cholesterol? Did you stop eating the fatty foods like the mayonnaise?
Are you exercising?
Right. Are you doing that? Are you eating more, drinking more water? Are you not doing that? Those are the things that we want you to be truthful with. Don't just tell us yes, 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 because your blood work gonna lie. The DNA doesn't lie.
It does not.
DNA does not lie.
It does not.
You don't understand. We can tell if you're taking that medicine.
That's right.
We can tell if you're not taking that medicine.
That's right.
We can tell, oh, I missed a few doses. You sure you just missed a few doses? We can tell.
Look.
So that's what we want you to understand. We're here to help you. We don't judge. We're a non-judgmental zone. We're a safe space. I don't care if you come in here and tell me you went to Timbuktu and back and had all this different fun inside. I'm going to ask you, how did it happen? And tell me what happened.
That's right.
We're non-judgmental, and that's what we want you to find in your healthcare professionals is those non-judgmental people because we don't get paid unless you come in. So it's like, why be judgmental? We're here to help you.
Look, all right. When it comes to you telling the truth about your health, all right? So, and I'll start this off with my experience. So I'm in the doctor's office, not this past week, but the last time I had to go before that. And, the doctor's asking me questions. Mm-hmm. You have any pains here, any pains here, any pains here, any pains here? And I knew those questions were going to be asked, so I kind of prepared myself before I got there. It's like, okay, they're probably going to ask me about these certain things. But it never came, and this is just me, and I'm not saying this to say I'm better than, but it never came across my mind to say, maybe I shouldn't tell the doctor this. And the reason why it don't cross my mind is because if I withhold information, that's not going to help me. So as a provider, help me help you. Don't help me hurt you.
That's right. That's right.
So,
I like that.
so if you can withhold information all you want. We're not going to twist your arm for you to tell us the truth. But at the end of the day, it doesn't affect our health. It affects your health, and it puts you deeper in the hole as far as what it takes to be healthy.
That's right. That's right.
And the doctors are not going to twist your arm about it.
No. We don't. I mean, the visits are too short, and nobody has time to just keep scratching the surface, waiting for you to be truthful. Because, like Joe said and Mathias said, it's your responsibility. You know, I don't follow you home. I don't. I'm not the little.
She wants to follow everybody home.
You're not gonna let her though.
We're not gonna let her, but trust me, she wants to follow people home. Did you do this, sweet pea? And you just fall into the trap. But that's part of the thing. But you're not gonna find every provider that's gonna be that loving and caring. And that's what we want you to understand. Some people, they're gonna come in there, and some providers, I hate to say it, they're gonna look at you like a number. Hey, okay, this is it, this, that's it, I'm done. Okay, have a nice day. Here's your report. But we have to understand that might not work for you. That works for some.
That's right.
It might not work for others.
That's right.
Everybody doesn't have the same ethics, I should say, or morals when they go see somebody. When I see somebody, I want to make sure when they leave the provider, they have every answer that they came in there with to answer.
And if they have a question, they can call us back.
Right. But you know what? Going back to the question you asked Ms. Steeple about determinants to men's health, right? Yes. Another one that just popped in my mind is more of a social economic thing, but poverty.
Is who?
Poverty.
Because, like, going back to what we're saying, most of the time, for the most part, I'm working 12-hour days to sustain myself or my family. And if I live at the poverty line or below the poverty line, or I'm in that space where I'm not in the impoverished level, but I'm not making a lot of money either, but I make too much money to get benefits, but I don't make enough money to really make it.
Oh, you that one person that make that dollar over that can't get the seat.
Right. That's a very good point.
And see, those things, all right, so now I have to work, and I have to have that mentality to work.
That's
work. Because all my life, everybody around me is like a man must provide, protect, and profess, whatever the three things, three P's, right? And because look, man, I can be on YouTube, Facebook, Instagram, regular TV. I got Steve Harvey over here. I got this person over here. And this is what a man is. This is what a man is. This is what a man is. And so I'm trying to bend myself each and every way to become a man. Guess what's the last thing on my mind?
Health.
Right.
That's
but you know what though, Joe? Like me and Miss Steeple were talking about earlier, to go on that, is you see a lot of men are being raised by single parents, and Miss Steeple was like, the household kind of has an effect on it. But me being personally, if you're raised by a single mother and the mother is taking care of her health, wouldn't she also try to teach the son to do the same thing and try to get him to go to the doctor? But you still people try to put men in a box.
Yeah, exactly.
And it's only a certain way you can be. You got to be this macho, masculine man, and that's it. You can't cry. You can't show weakness. You can't show pain. But that's not every man. There are some men who are more feminine outside that's not in the LGBTQ community, but they're just more softer than others. That's what I like about a lot of TV right now. Like some of these series, they're showing different sides of men that are still manly men, but they're not as masculine. They're not as, you know what I'm saying? In some people's minds, you get that image of this is what a man is supposed to be. And it's wrong. And like you put in a stereotype about how women are supposed to be, but it's stop putting people in boxes and labeling them, and let these people or the new generation be who they want to be.
But you know what though?
That's
Thinking
exactly,
about
that's a good
okay,
point.
and I once again I use my own experience. My mom go to the doctor a lot. She go to the doctor, but growing up, for me and my brother, it really wasn't. Even though we saw her going to the doctor, it wasn't stressed, or it wasn't like the thing to go to the doctor as a man, because she going to the doctor. In our mind, she was going to the doctor for women's issues. And women got and it was the perception was women had more issues to go to the doctor for, to make sure they keep stuff up. But after a conversation with my dad, though, that actually made me go to the doctor.
Ah, interesting.
And
That's very
so,
interesting.
but that goes back to what Mathias is saying, the influences within the home, because it's important for a young boy to see a grown man being a healthy grown man. So I can emulate those things. Because yes, I can see my mom doing that, but that's mom's.
That's right.
But and it doesn't even have to be a father figure. It could be an older brother. It could be a cousin, someone he looks up to, because we do understand that there are some single family households out there. There's going to be some fathers in and out there. There's going to be some people that say, I don't even have a father. You know what I'm saying? Or their fathers are deceased or whatever. But you're in a single family home. It still needs to be somebody else in your family that needs to step up and say, hey, how come you're not going to the doctor? Or, you know what I'm saying? Once you get those, I think in school, once you get those shots and that's it after that, it's like it's over when it's over. I need these shots to go to school. So while I get the shots, I get my physical, I get everything I need.
But that's real though. But that's real, because it go back to what you were saying earlier. It's like outside of yearly physicals or something like that. If nothing's hurting, we're not going.
Right.
We really not.
And we're not telling everybody got to go to the doctor every month. We're talking at least twice a year.
That's why the insurance industry they love young males.
Yeah, because we're paying for the insurance and we're not utilizing the service.
And you're not using it. Yes, that's exactly right. That's why they were, when the Affordable Care Act first came out, they were like, oh yeah, we'll get the young, healthy males to pay for that sick pool. The mature people who are not quite Medicare age, but they're sitting somewhere in the. You guys are what the insurance company look for. Those young, healthy males.
But no, I'm glad you said that. I'm glad you said that, because that's important for young men and people period to understand. It's you sitting up there feeding the pig and not even using the services. That don't make sense.
That's right. That's right.
And I did it for a while. Trust me, I'm saying it don't make sense. I did it for a while, because it was like, because me personally, I don't get sick. I'm not a person who really had health issues over the year, but that didn't mean I didn't need to go get checked up. Right? So it wasn't smart, but it's just like that's just the mindset. But once again, once I saw a male that I had respect for, like, you need to go to the doctor.
That's right.
That's
right. So it's because, ask Mathias, what did he say to me yesterday? I said, Mathias, well, what time are you going to work? Oh, Miss Steaple, I don't have time to do that. I got to be to work at 6:30 in the morning, and then I'm going. You going. That's the mindset. Go. And I'm like,
until something's wrong. And that's where a lot of people, and I can even say some women are like that, because they are, and it's like just seeing a trend in the patients, like especially with now, jobs are scarce. So when you got a job, you're like, I don't even want to ask off for work sometime, because what's going to happen if I keep asking off to go to the doctor? And then they're going to want to say, well, why are you going to the doctor? Then I'm putting my job in my business. So if I do have an autoimmune disease, or if I do have something else going on,
That's
And my
right.
boss and them are going to be like, well, so Mathias, you keep going to the doctor. What's wrong?
What's
What's this?
going on?
And then it's like, because you don't have to disclose your status or anything to your employers, but they're going to want to
Right.
figure out what's going on. Like, even when you turn that note saying doctor's visit, your boss is like, dang,
Well,
they
what's
had
going
4 doctor
on?
visits this month.
Right.
Like, are you
Right.
okay? Do I need to do some extra precautions? What's going on?
But
Do you
let me ask you, let
working
me
right here
ask
in the
y'all this
pandemic?
question. Do y'all think that that is something that is actually happening, or do you think that that's in that person's head that they think it's happening?
Well, I think it's a little of both because I've been
You
on
mean
the
like
spectrum. Go ahead.
you mean from like the employer or the employee?
From the
Yeah, because
employer.
you become self-conscious by turning in. That now I have heard that from 3 males. I've
Now
heard
you've done that, but I heard it from some patients, Miss Steeple, where I actually had to get on the phone with the person to say, hey, they can't come into work today. They at the doctor's office, they not feeling well. And so they was like, well, I just
Well,
need
yeah,
to know because we have a whole lot of people who are like 16, 17 who work, but you can't choose because somebody else does something doesn't mean everybody else is doing the same.
Right.
You got to give people
You got to
benefit.
be a better chooser of talent.
That's
And
right.
so, but like when
That's right.
people are really sick, especially like now, like even doing, you know, saying some things, some employers have been like, well, they need to come into work. No, they got these signs and this, they need to stay home. And
Ah,
or they're not feeling well,
interesting.
they need to stay home. But I understand people are short at work and I understand those things, but we got to take a charge to do what we need to do for our health as well. Because if you have a cough and weakness and all this other things and shortness of breath and you keep going to work, you might not be safe for COVID. Right now, you might not be positive right now, but what's going to say in a few days and you pop up positive? Look at
So
how
so
many people
my
you exposed. So
so
like,
my question is that what would you tell those males who are they're sitting on the fence. They know they need to go. They need to go to the doctor. However, they are they're not salaried. They're hourly. So would you say, "Hey, talk to your provider about maybe we can come up with a time when I can see you or talk to you on the phone." What advice? Because I think all of us have run across I can't make it. The young man that we saw yesterday, oh, I get off. I go to work from 8 to 6:30. I can't
Well,
make it.
well,
well,
Ms. Steeple, but that takes the person to take charge of their health care. Again,
Mm.
it makes that person responsible because if I'm the provider and I don't know what's going on and why you can't make your appointments and you're not talking to me, discussing these type of things, then I can't fix the situation. But if you talk to me and say, hey, Mathias, I can't come in until I get off work at 5 o'clock. I know y'all leave at 5:30. Is it possible for you to stay?
yeah,
So
we stay late that day.
and we just gonna stay late that day.
Now,
I can't speak for every facility for doing
right,
that and every
right.
provider, but I can tell you for me, because my job is to help. Because trust me, Joe and Miss Steeple and everybody that know me will be like, Matthias, you're
Now,
gonna get in trouble when you get home.
but no,
But
look,
it's
look,
about the patient.
I'm cool with you getting in trouble if we helping somebody because and like you say, that's us.
That's right.
Mhm.
But the most important thing you said within that was communication, right?
That's right.
So
Communication.
it's like with you, you are my supervisor.
Mhm.
If I need to go to the doctor, I'll let you know in enough time, and then I'll remind you. And hell, sometimes you remind me,
Mhm.
right? But
That happened the other week. I was like,
right,
Joe, you got to go to your doctor's appointment.
right. It goes back to communication. What you said, right?
Mhm.
So if I communicate with my provider, I work at such and such. I don't get off until this time, and I'm not in the position. They're not flexible. I'm not in the position where between this time and this time I can get off. Is there any way that I can still be seen after this time? Is there anything we can do? Can I be referred to somebody? All these different things.
Mhm.
That conversation should happen. And if you go to your provider and your provider can't help you come up with solutions, it's time for a new provider.
Right. But see, even here at neighborhood, I gotta throw it out there. We do evening clinics. We have some nights to 7, 8 o'clock at night, depending on where it is. Also, right now, it shouldn't be no reason for any man, any woman, any child to say they ain't got no visit with this telehealth. Now I'm gonna preach on my IT side, me and Joe about 19th string IT over here.
Hey,
But we gonna sit there and say, point blank period, we can do a telehealth visit. Guess what? It's just checking them in, and that's the conversation between you and the provider over the phone. She can talk to you on the phone, or we can send you a link, and you could be seen like we're doing right now, face to face. So guess what? If you got those things that's gone awry, and you need to show us something gone, like, hey, I got this rash, or I got this, she can still see it because you can show her on the camera. So there shouldn't be no reason, and guess what we can do? That could be at your lunchtime. That could be on a 15-minute break, because guess what? You get that time and say, hey, boss, I got to take my lunch at this time. Can I please take my lunch at this time? Or, like Joe says, communicate with your boss. Say, hey, I understand, we're busy with this. I got an appointment and I set it out for 2 weeks. So in 2 weeks, can I just take off? Can I make my lunchtime at this time? The provider could do a phone call and you go to your car, you sit in your car and have your visit. I done seen my coworkers have their own visit sometime on their lunch break in the car or in the office and just say, hey, I just need to talk to my doctor real quick, because we do understand that it's there. But with this, the pandemic has opened up new technology for us, and we're able to use that, but we're not utilizing those services. We can see you via the telehealth system, and we can do it and get everything for you without you stepping into the building. Now, the provider gonna bug you here and there like mine does, and says, I need a blood pressure. I need this. I need that. So there's a chance you're going to have to come in at some point in time to get certain stuff. But we make things happen. And that's what we want people to understand, that you got to communicate with your supervisors at work sometimes. Say, hey, it's a team. It's a team. And to me,
it is. It's a team.
Our thing here in neighborhood is teamwork make the dream work. Right. And so if all of us are on the same page and we know everything, it's a flawless system. If I know Joe got to be to me to be seen by 9 o'clock, Joe gets here at 8:59. 9 o'clock, Joe should be in the back. We already communicated, because Joe got to be back to work by 9:45.
That's right.
Right.
So if you communicate, we can work those things out. Those are small, minute things that we can work out, but you got to communicate.
Now, one thing women are very good at, and I will toot our horn.
Communicating?
No, I didn't say that.
Okay, because not everybody communicates. I gotta advocate. Some men communicate better than some women.
I didn't say that.
Now, I gotta go pro man right there real quick.
But one thing I will say is that women are very, very good about the buddy system.
Okay.
Now we are.
I give y'all that.
I'm gonna be honest. I will hear women say, hey, call me if you're going walking, or hey, can I get that recipe? Women are very good about that.
They're good at networking.
And also, now I can't say all the time. Now, we will cop attitudes, but eventually we will come back. Right, Joe? Matthias? Yeah, come on now. Y'all, how many times have y'all heard women say, girl, call me, or girl, where'd you get that from? Come on now.
No, I like I said, I give you that. Definitely give you that. Because now with us, we're more
independent.
And let me get this thing done. But once again, to go back to socialization.
But it also go back to Joe, men are more secretive sometimes.
But it's
because we scared of what other people are gonna say, the judgmental portion of what it is. Because like I say, we don't fit into that box. And if I'm sitting here saying, and it goes back to, you got to be careful who you talk to, because everybody ain't your friend, everybody ain't your stuff. Because you could tell your homeboy, you think your homeboy, and the whole community know that this done went down.
Well, let's take it a bit deeper. Don't socialize me to be one way and then get mad when I'm that way.
You right.
You know, and it goes back to the socialization of men. Men are socialized to be secretive.
But Joe,
Men
now I'm going to
socialized
have to step on the other side now, because you can't socialize women as to be certain things and in a certain box.
I get you.
Get
I
mad
get you.
when that
That's
woman
what I'm
is
saying.
saying, I'm into this box and I'm that ram, and why you ain't taking care of everything.
Right? No, I get you. It's for me. For me, it's across the board.
Right.
Because,
It's equal. It's
right,
equal.
but it's like for men, men are socialized to deal with our emotions a specific way. Men are socialized to communicate a specific way. Men are socialized to go about handling our business a certain way. But
Right.
the way we're socialized to go about doing that is not the best when it comes to not all relationships, but certain relationships that you have to have, especially like a health relationship with a provider, especially if you're talking about a new provider. I don't
Right.
even know you, and we got to talk about my body. We got to talk about all these different things. If I'm dealing with erectile dysfunction, I don't know you, but seriously, like think about that.
That's right.
And what environment? And I'm not gonna say it doesn't happen across the board, but for the most part, what environment can a man feel comfortable talking to other men or even women about erectile dysfunction, and he not think that, oh well, if this goes left, it's gonna be brought back up
You're
as
right.
right.
Well,
But see, that even goes back about how people feel about who they're dating, or if they're LGBTQ, or if they're on the down low, because that happens a lot.
that's
And
right.
they say,
That's right.
"Oh, I'm having sex with a female," but then it's really not a female; it's a trans female.
Right, but see, that's what I'm saying.
So,
Like,
and it's like that's why it's important to tell, because
That's right.
we can't help you if you don't tell us. And
it's
but
like,
how do
right.
we break down that judgmental thing, or the fear of people being judged? Or I guess the stigma goes back into healthcare. A lot of men have stigma when it comes to healthcare about, you know what I'm saying, because they don't feel like they fit that mold. So I guess the question is, how do we break that mold, Joe, Miss Steeple?
So I was like, for me, all right, me, Joe, Matthias, Mark, Ian, all the men that work in neighborhood, we start with us. We operate differently, right?
Mhm.
So guess what? I'm a grown man and I'm all man. And if I feel like crying, you're gonna get these tears and ain't nothing you gonna do about it. Right?
You right.
But it goes into that. Okay, hey, this something doesn't feel right. I need
Right.
to go to the doctor. Let
Right.
me also let somebody else know what's going on just in case things go left.
That's right.
But
That's right.
it's destroying this archaic idea of what manhood is, right?
Mhm.
And and I communicate that I'm communicating it this way because there are a lot of men who think that having a paradigm shift means
Weakness.
right, or inviting more feminine qualities in, and that's not
Right.
necessarily
Right.
what I'm saying.
Right.
Whatever type of man you are, be the type of man that you are. But
Right.
at the end of the day,
That's right.
if we continue with this old way of thinking of a man is one way. If I break my leg, I'm not trying to be the toughest. My leg hurt. It's broke. I ain't trying to be the toughest man in the room. My legs hurt.
Right.
That's
I need to go take care of my health.
That's right.
And for me,
Just funny.
I'm thinking about long-term quality of life. Because there's a difference between being 80 and alive and 80 and thriving.
Mm-hmm.
That's right. And one thing I will say is that when erectile dysfunction is brought up to me, I initially I'll get the hem and the ha and then I just tell them, listen, this is just a function of how the body works.
Mm-hmm.
I really don't give a flip about whether or not, you're embarrassed or not. This is how the body works. This is the condition you have, and this is the result. The ED is the result of this. Do you want the help?
Mm-hmm.
Let me know. And then if not, I'm out of here.
Right, but Miss Steeple, like, to contest to that, it's like we're seeing a lot more younger people with ED.
That's exactly
And that's
right.
part of the things that we're going to discuss, because me and Joe's favorite motto is poor heart health equals poor penis health. Good heart health equals good penis health. You got to have your blood flowing. And
Right.
people understand, you forget that your heart, which is a small portion of your body,
That
it,
pump.
it pumps a lot of things to make you survive and live. But also, one thing that I was thinking about that we definitely need to cover, and I think all of us we talked about it earlier today, was mental health. And with the men being put in a certain box, and especially in the African American community where it's taboo to talk about mental health.
That's right.
When men suppress certain things and these feelings, it causes them to have more mental issues and things like that, because only a person can take only so much. And it's very important. And now this is for men and women. It's not just we're titling it to men, speaking to men, but women listen out there too, because it's affecting everybody. Everybody is not strong. Everybody has a breaking point.
But you know what, Mathias and Joe, the thing is that I don't know if anyone watches This Is Us or a million pieces, One in a Million Pieces, or it comes on ABC. But you know what? They are tackling mental health in Black men. They actually have their main characters seeing a mental health counselor. And I'm like, that's really nice. They're tackling that head on. And so I'm really impressed with that. I'm really impressed with that. Now, that is the television world. Sometimes it doesn't resemble, the real world, but at least they're tackling it.
Right, but that goes back to show that modern TV today is actually starting to show up, because back in the day you saw it was a husband, wife, kids, la 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 la, we picket fence, white picket fence, we live in a house. Now you're starting to see mom and dad, we living in the projects, or it's mom and the three
Two
kids,
moms.
no daddy in the life, or you have the two moms or the two dads. All those different things are coming out.
That's right.
And people don't understand that it's hard for people to deal with everything. I got people telling me one way, but then I'm fighting on the inside to feel a certain way.
That's right.
And so, and I don't fit that box. So something's wrong with me if I don't fit that box. I'm a masculine man, but I like girls and I'm this and I'm that, but I'm just not as masculine as people want me to be. Or I'm the scrawny dude that's, a little bit more out, I'm more timid in this, but you're still trying to put me in that box, so you make me feel like I'm an outcast.
That's right.
And when people do, or they dress a certain way, or people try to feel, oh, you're not a man because you're wearing skinny jeans, or because you're wearing this outrageous stuff, or you're more gothic, or you're more preppy, or you're more this, and you're not wearing the baggy jeans and the hoodies and things like that. But people, that goes back to basically how people socialize and people put people in boxes. And it's a lot of people who are out there who are hurting, but they're scared because, again, it goes back to the stigma like me and Joe was talking about before. Where can we break this down? Yes, we're making advancements in TV. We're making advancements, I know, at Neighborhood Medical Center. I can't talk about any other way else. But how else can we do, especially for the people who are listening? If you have ideas or things that can help us, or ways that you think we could, we want to hear from you guys as well. It's just not a one-way street. Like, help us in these different challenges that we have.
I will say this to our fellow, I say this to us first, our fellow healthcare providers, our community activists, our social workers, anybody who's in any capacity helping to improve the conditions of the communities that they live in. In addition to what's happening on TV, let's not come with the idea that because mental health is being given to men on TV, that everybody's watching that. So we're talking about in addition to, because like community health is a team sport.
It is. It is.
So like even this podcast, the people who at the corner store not gonna watch this podcast.
No, they're not.
Right. So we have to make sure we have other means of things going on, other things happening to be able to catch the people who not gonna catch this podcast.
So what are some of the things, Joe? I mean, because now we're in the day and time of COVID, and so we can't. Well, we're not supposed to congregate.
But see, that's the thing, though. Like a lot of the men we would be targeting. Guess what they are doing? They somewhere congregating with no mask on.
Yeah.
Not all, but some. Right.
Mm-hmm.
So
mm-hmm.
to go into these, really, if you're gonna go into these communities in these areas and help these particular men, you have to understand that there is a chance that you might contract COVID. You have to understand that. Now, does your organization have the resources to put you in enough protective gear to go out and talk to these people? But now, if you walk up to these men in full PPE, what's going to be the response? And see, all those things you have to think about all those things. And we're not trying to come up with all the solutions here, but we do want to get the creative juices flowing.
That's right.
Even for us, because we have to really think about how we're doing it. So one thing we've done is incorporated our food distributions, our neighborhood COVID test.
Okay.
So
okay.
So like doing a food distribution, we can load up some food and have a quick conversation or have some kind of conversations and things. During the COVID test, got a little more time to have a conversation with you. Also, let's say we can still go by and find a way to drop off information. Find a way that certain people have information. Get information to the gatekeeper. Somebody who may already still be in that environment. Get information to them. But there are different things that people can do. We can't just sit back on the sideline and say, hey, we need to help men. We need to help men. Oh, yeah, COVID. Dang, we can't help men. No, all right, COVID is happening. How do we get over this hurdle to be able to really help more men access healthcare?
Well, one thing I do want y'all to, Joe and Mathias, for y'all to touch on is definitely working on communicating with their sexual partner. If you know something is going on, oh Lord, please communicate to that partner. Give that person a chance to say, I'm with you, I'm not with you. Because that is the one thing that I run up against every single time. Men do not communicate. The ones that I see do not communicate. Do I have to tell them? Oh, I didn't tell them. When should I tell them? Before you get into bed with them.
Now, let me ask you this. Let me ask you, why do you believe they're asking you, do I have to tell them?
You know, that, I don't know. I mean, well, the thing is that fear is a really big thing. Men do not, at least I haven't met a man, and I've been around for a while on this earth. I have yet to meet a man who can take rejection head on.
Better than women, though, I tell you.
Yeah.
Well, yeah, because women sometimes will burn up your stuff. We'll burn up your stuff, but don't y'all think rejection is a big piece?
Yes and no, but Ms. Steeple, and that's one of the podcasts that I think me and Joe are going to do next is about sexual health responsibility. And the thing is, when I say responsibility, it takes two of y'all to tango.
That's true.
It takes two of y'all to get in that bed together.
That's so true.
Now, for a person like myself, my questions are, first of all, have you had a COVID test? When was your last COVID test? Because one, I can't get COVID because I can't be out of work. Number two is, when was your last STD test? Have you ever had an STD? These people do not ask questions. And it's okay because you're caught in the moment. You're caught hot and heated. You have influences that are there, like alcohol and drugs and other things that go about that kind of, take your mind out of that. And then you have that good old feeling like, I'm I'm horny. I'm ready to get it on, and you're horny. I'm there. I'm up. It's there. Let's go. We make it happen. It happened a few minutes, and you out the door, and you going about your way. And then everything sets in after you finish.
Yes.
That guilt sets in when that high comes down,
That's
or when
right.
the drunk comes down,
That's
or
right.
when you get back to your right mind. But right then, you were just in the feeling of, oh, I just need to get me a piece. I need
That's
to get
right.
me some right now.
Right.
And that's what happens.
And then you're cloaked in invincibility, where you think you're invincible.
Right.
Mhm.
But also factor in this. It starts with a stig and ends with a muff.
Yeah.
Right? Because going back to what I was saying earlier, okay, guy meets girl, guy want to have sex with girl.
Right.
Guy says, all right, I have HIV. Just want to let you know before this happens.
That's right.
Girl says, ugh, get away from me. And goes tell everybody. Right? And so, and not to make light of that, but in a lot of people's mind, that's going to, I've seen it happen.
Yeah.
That's how, think about it. On you know my favorite hood website, www.blankblank.com, right? I'll tell you the real website offline, but blankbird.com, right? think about, and I call it, sometimes we call it the wire, right? But think about how many HIV tests have you given out to somebody? It was a negative test that they gave them back, but the reason they getting tested is because the hood said they had something. And they got to show everybody in the hood that they negative, right?
Or they get online or Facebook and show it that, look, I'm taking my HIV test. It said I'm negative.
So we got all these factors. We got stigma. Plus, nobody taught me about sex.
You're right.
That's right.
So,
that's right.
No, because you know that, Joe, they taught about sex. They taught about sex.
Well, they saw it.
No, the thing was, they said, and I think every man can attest to this. Your mama told you, don't you bring no babies home. That's it. But they never told you how not to bring the baby home.
Just don't go buy a baby doll. If you don't go to the store and buy a baby doll, you can't bring it home, right?
Right.
But that's real though. So like you're saying, what's the practical application to not bringing the baby home? Right? And so if only thing you told me is don't bring a baby home, I don't even know these STIs exist. Like think about how many times, like it was 20, like even 2019. Well, we're passing out flavored condoms. And somebody asked, well, why do I need a flavored condom? Well, what's the purpose of flavored condoms? What do I use it for? And you looking at, and you try, I know I have to catch myself because my facial expression, sure, I be trying not to be like, are you serious? But it's like, because like, what's the only part of your body that can sense flavor? And then think about it. Your mouth. But we're so ill prepared for sex, it's ridiculous. Look, it's ridiculous how ill prepared we are. So when they come to you, Miss Steeple, when these men come to you and you say, are you talking to your partners about sex? You probably the first person to ever ask them, have they talked to their partners about sex?
That's right. Joe, you got to remember, everybody's not Miss Steeple. A lot of providers don't ask about sex. They don't ask what your sexual behaviors is. There's been a few doctors that I had to fire from my personal health, not from work, from me seeing them. And they be like, well, why you keep changing your doctor? Because the doctor don't fit me. The doctor doesn't work with me. Like, you have to be able to be open and free to talk to your doctor.
That's right.
And
that's right.
I know as a healthcare professional, I know what the doctor should be asking you. And why you not asking me? Just because of my sexual orientation or does not dictate my visit.
That's right.
Everybody is treated the same and everybody is treated equally. Heterosexual people get STDs just as much as LGBTQ people get STDs. And it should be a standard of care that you ask these questions. So we're going through your sexual history. Have you had an HIV test recently? What type of sexual activity are you doing? Are you in a monogamous relationship? Are you having multiple partners? Are you cheating on your wife? Guess what? We find out a lot of information from these people from asking these questions. Sometimes we find out too much information and we just be like, okay, But guess what? We can't say nothing. So if your wife comes in next and gets tested,
I don't even know you.
I
don't
know.
know you.
Talking about. I didn't just test somebody.
What the person in front of me came, that's my husband. Well, ma'am, you gotta talk to him. I don't know anything.
But sometimes
That's it. And it's the same way with kids. And we want the kids to know, these young guys and young girls, y'all can come get tested and do things without your parents' permission.
That's
because
right.
we want to make sure that we keep you healthy and safe. And a lot of times the young kids will go out there, the young boys, and will be having unprotected sex and don't know what's hurting, what's leaking, what's this, what's that.
But sometimes, Mathias, now all three of us can attest to this. When they see us out in public, they feel like we're Catholic priests and they have to confess. Oh my gosh.
Right. But once again, that goes back to the work we do.
That's right.
And so that's
making
a tip of the hat.
Making them feel comfortable.
That's a tip of the hat to you all, right? Because I have to get comfortable enough with you to even look at you as an authority figure, looking at you as somebody I respect. I have to respect you to see you in public and sprint up to you to make sure I introduce you to my mom.
That's right.
Make sure my partner knows, hey, this Dr. Staples. Even though I said your name completely wrong, still, this is Dr. Staples. Hey, baby, I want you to meet Dr. Staples. Why? Because Dr. Staples has made me feel good about myself. Dr. Staples cares. And so that real work is going to show in how the patients react to what you're doing. And if like I always tell people when you're doing like community outreach and stuff, if you don't have no nickname in the hood, the communities that you're working in, don't nobody know you in the communities that you're working in, you just work in these communities, you need to step your game up. You're not impacting people. You're not touching people.
A nickname. That's really interesting.
And Ms. Steeple, like me and Joe do a lot of education in the community pre-COVID. It's killing both of us that we can't be out there in the streets right now.
I know it is. I know.
But like even when we do these classes with the different programs at the schools for like the middle school and high school kids, and speaking to their teachers and stuff, they really appreciate us because the kids are actually open with us. They step out the class and let us have free range in that class to talk about things. The kids open up and ask us so many great questions.
Wow.
And it's so fun because you see them out in the community and they'll be like, hey, Mr. Ward, hey, Mr. Sweet, I'm doing good. I'm doing this.
That's great.
Or if they have questions, they know, hey, I can't really talk to nobody else. Can you talk to me about this? And they call us and they talk to us, or they find a way, or they'll be like, they ask the teacher, can you get me in contact with Mr. Sweet? I got a question I need to ask him. And so we communicate, and it's so good because the kids be like, y'all coming back again next year?
Oh.
Feel good that, you know, saying that we're beating the odds of trying to break these stigmas with men as well as young women on education, because a lot of these young kids, they're out there having sex and don't know what they're doing.
Right. Like we
gotta break this.
Right. It's like literally we out there, we doing what we do, but literally nobody sit down and took the time to say, hey, make sure you use a condom. Hey, make sure you do this. You might heard it from one of your friends, but guess what? I know that friend ain't really having sex, so why am I using a condom? Because they ain't getting none. So maybe that's why they're not getting none.
And the thing is that do y'all ever, like when I was growing up, they would separate the girls and the boys.
We do. We separate them for one reason only, is because some of the girls, like when we go on our talks, we talk about health, we talk about sexual health, we talk about everything. So a lot of the girls have some, you know, saying feminine questions that they ask the healthcare professional, because we break it up to where we will have the guys go with the guys and the girls go with the girls. So we'll have a practitioner for both, you know, saying educated professionals for both, so they can ask those questions. The girls ask questions about feminine hygiene, about douching, you know, saying about different things. We even got a video that we love to show about Fat Albert and the gang, and it talks about body odor.
And what toothbrush and your comb.
So like different things like that to get the kids' attention, because these kids are visual, and it doesn't, they don't know because nobody gonna tell them they stink. You know what I'm saying? They friends don't do that. They just go along with the flow because they don't want to hurt people's feelings.
Right. There's a method with that too, though. So we will start separate. But if we get a chance, especially we get a chance to do more than one class with that group, then we separate them so we can get the basics down.
Okay. Okay.
Because we want to be able to teach young men about their bodies before we even let's talk about you and your penis before you even start talking about her vagina.
Yeah. That's a good point. I was just wondering because, when I was growing up, they wouldn't talk to us. They showed us a film.
Right.
Yeah, but the film is cartoon characters.
Right. But I do believe
real live images.
I do believe at some point you need to bring them together, and the women, even if you separate them again, the girls need to be able to talk to the men, and the women need to be able to talk to the young boys, and because they need real perspectives. Like it's one thing for a 15-year-old girl to have a 15-year-old boy who's never had sex try to give the male perspective about sex because he watched a couple porno flicks. Versus somebody who's actually had sex, who understands sex and sexuality and the science of sex, to break it down to a young girl in a real practical means. So she will look at sex as a good thing it's a good thing, and I can also equip myself to keep myself safe rather than some busted open nasty thing. So, and then nowadays, you got to think about nowadays. We was talking about how bad it was before social media. Your kid on TikTok letting Nancy from Iowa teach your kid about sex. Nancy don't know nothing about sex herself.
Interesting.
Or, Miss People, you got to think when you get these, and that's why I go back to mental health as well. You know what I'm saying? I keep going back to mental health for some reason. But like the mindset of some of these men aren't really the same as some of these girls. A lot of these girls are more mature.
Yeah.
They be in places they're not supposed to be and things like that. And you know what I'm saying? It's vice versa for the guys as well. But it's just, you know what I'm saying? It's the mentality of everybody. Everybody's not on the same level. And sometimes you got to break it down because there's one or two people in some of the classes you be like, okay, we really got to look out for this person and say, hey, let's have a few more conversations or let's do this or let's do that. Or what way can we break it down for them to understand because they may not understand. And so like just learning with their health. And it's not the person that keeps coming in to say, hey, we're going to talk about sexual health. You got to be present in these kids' lives and be a reoccurrence. Like me and Joe are reoccurring in a lot of these people's lives that we're there, that they feel comfortable. You need to see people at the doctor's office. Like when I go to the doctor's office or stuff, when I go, I gotta understand that, you know what I'm saying? I gotta know these people. Like when you go to the restaurant, you feel good when you know the waiter or when you know the cook or you know the person. Hey, such and such, how you doing today? It makes you feel good when they say, you know, Mr. Sweet, I'm doing good. How you doing today? It just makes it feel more home and it makes you want to take care of it more. And if people are more homey and more feeling, I think that will end a lot of that stigma and things with healthcare and things like that because they feel like other people care.
Well, this is what I will say. I'm going to have to close it because I have a patient that I have to see. But I do want to say that this is just the tip of the iceberg for what is coming up in reference to men's health. As you can tell, nothing is black and white. Everything is gray. You know, there is no clear cut to how to do something. You know what I mean? There are several ways of doing things. Like Mathias said, hey, if you can't make it to the clinic, do telehealth. Telehealth, if you can't get there at 3:30, maybe we can, get you there by 5:30 or 5:15. Nothing is black and white. And so I think for a lot of people, they think it's black or white. And it's not. It's not. So
and like for my closing out thing is, you know what I'm saying? Me and Joe learned through a training we're living in the new now. And Miss Steeple, I like that you said the gray. It's gray because that's the new color for right now with everything coming up is gray.
It's great.
And maybe this is a chance for us to say after this pandemic or through the pandemic, we're in our new now. So now is the time for us to shape and mold America to stop looking at these statistics and say we're in a box and we're this. So I challenge everybody out there to say, hey, stop putting people in boxes. Stop going to those boxes. Reach outside those boxes and see how much more we can grow. Because now we are living in the new now, not the new normal. Because what was normal? We're in the new now. We don't know what normal is anymore. This is what we're doing, and we're figuring it out. And so I challenge everybody to let's figure it out. Let's jump outside those boxes and see how far we can get.
That's exactly right.
So I mean, men's health is an ongoing topic. Now, men's health is not the Rubik's Cube people make it out to be. But men's health is something that we need to tackle. I do think, like what we did today, let's start having more discussions with men about what's going wrong and what's going right. And once we start having more discussions with men about those two things, we can start to build plans around them. Remember that community health is a team sport.
That's right.
Realize that your health is your responsibility, but you're a part of a team.
That's right.
Right. And soap and water, and your comb, you should learn to use them or you'll stand alone. I had to finish. I had to get that out. Hey, man. This is Mind Your Body and Soul, the Healthy Podcast, brought to you by Neighborhood Medical Center. He's Mathias Sweet. She's Miss Alana Steaple, aka Dr. Staples. I'm Joseph Ward. Remember, this is Mind Your Body and Soul, the Healthy Podcast, which is an educational podcast that focuses on all things health related to help our listeners become the healthiest versions of themselves. Right? We seek to inform, uplift, and empower and mobilize our listeners. And I said that backwards, but I said it, so it don't even matter. Remember, check out our website, www.nocpodcast.com.
Check us out.
Wednesday. Right. Facebook, Neighborhood Medical Center, Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts. We on all of them. Check us out. And if you don't know, now you know. Peace out.
All right, y'all.
Bye.